if their meal times are irregular, no matter how much they control their diet and avoid the food triggers, they tend to still have symptoms just because if they're having 2 very big meals, it's a lot of food at one go, the stomach might not be able to digest it.
So going to binge eating or going into buffet is not really a good idea?
Not if your stomach is
I just booked. I'm Kewin, a gastroenterologist with NUH, and I specialize in irritable bowel syndrome or IBS.
I'm Grace, a dietitian with NUH. Today, we are going to answer commonly asked questions on how to manage IBS.
IBS is a common condition that affects the intestines. A person with IBS may have often complained about cramping pain in the tummy, gas, or bloating. The other key features are abnormal bowel habit. Patients may suffer from diarrhea or constipation, and sometimes both. Our study shows that 1 in 5 people suffer from IBS in Singapore. It can affect men or women of any age, but in Singapore, IBS mostly occurs among people in their 20s and 30s. Well, we don't know what exactly causes IBS, but we believe it's due to a combination of many factors, such as abnormal movement of food through the gut, gut hypersensitivity, changes in the gut microbiota or bacteria, stress, anxiety or depressions, then so-called the brain-gut connections, and definitely the food we eat, hormonal changes. IBS is a complex condition and the causes may vary for different individuals.
Dietary advice for IBS varies depending on the individual, but we have some general recommendations that may help manage your symptoms. Increase your soluble fibre intake. Eating adequate amount of fruits and vegetables and whole grains can help regulate your bowel movements and relieve constipation. Aim for 2 servings of fruits a day, 2 servings of vegetables a day, and whole grains at every meal. It is important to increase soluble fibre intake gradually and drink plenty of water to avoid any potential side effects such as gas, bloating and cramping. Drinking plenty of water and regular physical activities will help regulate bowel movements and prevent constipation. Start a food diary to identify and avoid foods that trigger your IBS symptoms. These are usually the spicy, fatty or gas-producing foods. Following a healthy and balanced diet and keeping to regular meal times will also help you manage your IBS. Eat small frequent meals. Smaller and more frequent meals can help prevent bloating and distension.
Reduce stress. Stress can worsen your IBS symptoms, so find ways to manage your stress, example exercise, meditations or therapy. It is important to note that dietary advice for IBS should be individualized and tailored to a person's specific needs and triggers. So it is always best to consult your doctor and dietitians. We hope this video can help you have a better understanding on how to manage IBS. To learn more about IBS, do talk to your healthcare provider or visit the NUH website or videos in the link below.
Thank you and bye!